To Allan now. Allan, are there concerns that you have of the government as it relates to healthcare?
I think, Joe, with any government, you wonder what their strategies are going to be, and I think we're in that stage right now. It's very early on, and it still remains uncertain as to what the formal positions are going to be, and how, probably more importantly, how our profession is going to be impacted. But government has been very clear in terms of its mandate that it's going to be looking for efficiencies without trying to compromise service or jobs. And so from that alone, we're still very helpful. We want to be helpful. We believe and we're aligned with that mandate. We've been concerned for many years that just working with the past government, that policies have often been implemented, conceived, drafted, that impact the profession, but that don't actually involve us in their construction, in their implementation. And one of the things that we're looking for is an opportunity to be at the table for policies, programs, initiatives, even regulations and legislation. If it's going to be impacting the profession, or if it's going to be impacting patients where we are going to have a role, we want to be at the table. We want to help. We want to collaborate. We want to be there to help with the construction, so that, and again, in line with that quadruple aim, we want to improve the patient experience, but we also want to make sure that it doesn't compromise the provider experience. So these are part of the concerns that we have. We believe that this government is going to be open to that type of dialogue. But time will tell, and nonetheless, we are hopeful. Again, I reiterate, we are at the front line. We are helping patients manage their health care every day, and we know the intricacies of the challenges they face each and every day, and we hear the questions. Our members can attest to the sheer volume of questions that they get. Things like, how do I manage multiple medications, whether it's for my heart or for my cholesterol? How do I what vaccines am I going to need if I'm going to be traveling? What over-the-counter products can I take if I'm using medicinal cannabis, to use that topic? And also, how do I, more importantly with the opioid crisis, how do I avoid getting addicted to my pain medications? These are questions that pharmacists deal with on a daily basis, and that's just skimming the surface. So because we're providing these answers to patients every single day, we believe we have a message that we can bring to government, and that our messages and our perspectives have value. And we believe that this will help with construction of policy and help strengthen our health system.
Well, certainly I would say that both organizations have done really well with the previous government of establishing the fact that you're not only advocacy organizations, but also repositories of considerable knowledge, health policy expertise. And I think an early challenge will be to ensure that the new government, the people in the Ford government, come to recognize quickly that you advocate, but you also know a lot about healthcare and pharmacy and the provision of community-based care. All right, so thanks for that, Allan.